Almost everyone, including you, has ever complained of ulcers, but actually do not know what exactly they are. Peptic ulcers are sores that develop on the innermost lining, or what is also called the mucosa of the stomach or of the part of the small intestine called the duodenum. Most ulcers occur when the normal secretory, defense or repair mechanisms of this mucosa of the stomach or duodenum is disrupted by several processes which can either be due to infections or drugs. Peptic ulcer disease is associated with two major risk factors. The first one being an infection by a bacteria called Helicobacter pylori. This infection weakens the protective barrier of the mucosa, making it more prone to damage from the acid within the stomach. The second major risk factor is the consumption of painkillers called NSAIDs, which include drugs like aspirin, ibuprofen, diclofenac, and piroxicam. These drugs decrease the amount of blood flowing to the mucosa, thus making it weaker and prone to damage from the stomach acid. Other risk factors include smoking tobacco, consumption of highly concentrated alcohol, genetics, diet, in that prolonged fasting and consumption of high concentrations of caffeine and spices increase the likelihood of developing peptic ulcers. Poorly tolerated stress and depression also increase the risk of ulcer development. Actually, very many people with peptic ulcers do not show any symptoms. However, those who show symptoms commonly present with upper mid-abdominal pain, food-provoked abdominal discomfort and fullness, early satiety, nausea, and sometimes vomiting. But some people with peptic ulcers do not present with any of the already mentioned symptoms. Instead, present with complications of this disease, which might be a bleeding ulcer that manifests by vomiting fresh red blood, passing dark-colored stool, or passing stool stained with fresh red blood in case the bleeding is too much. Other complications might be gastrointestinal perforations or penetrations. For a person who presents with some of the already mentioned signs and symptoms, the diagnosis of peptic ulcers is definitively established by direct visualization of the ulcer on upper GI endoscopy. It is important that all patients diagnosed with peptic ulcer disease should undergo testing for Helicobacter pylori bacteria using either the biopsy urease test, H. pylori stool antigen test, or urea breath test. However, for patients with negative Helicobacter pylori test and negative history of NSAID use, additional evaluations to determine the underlying cause of the ulcer should be considered. The initial management of peptic ulcer disease involves treating the underlying cause. For patients with positive Helicobacter pylori test, triple therapy is considered for eradication of the bacteria. This therapy consists of drugs, clarithromycin, amoxicillin, which can also be substituted for metronidazole in case a patient is allergic to amoxicillin. And lastly, a drug that decreases the secretion of stomach acid, which may be omeprazole or esomeprazole. For patients whose ulcers are caused by excessive use of NSAIDs, then discontinuation of these drugs together with an additional prescription of a drug that decreases stomach acid secretion is considered. Then for patients with ulcers that have a negative Helicobacter pylori test and negative history of NSAID use, The treatment of the actual cause of the ulcers, together with prescription of a drug that decreases stomach acid secretion, is done. Since prevention is better than cure, peptic ulcer disease can be prevented by effective eradication of Helicobacter pylori bacteria, avoiding excessive NSAID use, avoiding tobacco smoking and excessive alcohol drinking, considering having a good diet comprising fruits and vegetables, and lastly, avoiding stress and depression.